The National Center for Medical Readiness goes historically back about 5 years here at Wright State University, and we focus on medical readiness, defining that into 4 areas. Those include human population risk assessment, human survival systems, dynamic medical systems, and healthcare reconstruction. And in a nutshell, that's all about how the complex healthcare system would respond in a crisis or disaster. Wright State's perspective is unique. And we look at all of these complex events from the perspective of the patient or the victim rather than a hurricane. And that's an important and unique perspective that we take here at Wright State. So that's what really differentiates us from the rest. And then, of course, being home-based in a medical school is also very unique. Other disciplines that have been involved include public safety, firefighting, emergency medical services, and public health. But there's no national substantive effort for a medical school to do what Wright State has done. We thought about economic impact from almost the very beginning in this project. And it was pointed out to us here at Wright State as we started to think about this training center on a much broader perspective that the things that would happen as a result of our work would be tremendous. Within literally days of our groundbreaking last fall at Calamityville, development began in the area of 675 and 235. So we see the potential for hotels, restaurants, and hundreds of people coming to the region to participate in our training. The type of disasters we could simulate there would range from natural disasters, including tornadoes, hurricanes, earthquakes, even volcanic-type eruptions, and what the consequences would be. Then we move into some of the man-made type disasters, which could be related to transportation accidents, where you might think about train tanker derailment or tractor-trailer derailment carrying hazardous cargoes. And then we would also move into the area of what would happen in a hospital or a doctor's office during something like that. One of the things we say, and we have articulated in a number of different venues, is that the homeland can't be secure unless the healthcare system is secure. Back in 2008, when Hurricane Ike came through the Dayton area, we saw what could happen when power is interrupted. And so when you have vulnerabilities in a community, you want to be able to do things to ready that community from its medical perspective. So if doctors' offices are open, hospitals are available to see people, not just disaster victims, but the daily ebb and flow of patients, that contributes to the security of the homeland. So we tie the two together, and that's been part of the motto we've used, and it's resonated very well.